Hello, I'm John, and this is our presentation on GERD, or gastroesophageal reflux disease. So, what is GERD? GERD is, if it's not obvious from the name, it's a gastroenterological disease, and it also sometimes affects the respiratory system a little bit. It's a disease essentially where stomach contents, oftentimes bile, moves up into the esophagus, and that damages the stomach lining. Sometimes it can be caused by the stomach pushing through the diaphragm and creating a hiatal hernia. So this can lead to symptoms such as regurgitation, acid reflux, difficulty swallowing, a little bit of chest pain, heartburn, erosion of the esophagus, which in extreme cases can lead to like cancer. I should know I have this. I've woken up in the middle of the night feeling like I'm choking because that stomach content has moved up into my esophagus. It gets alleviated if I lay on my left side, but if I lay on my right, it can be really bad. So those are a few of the symptoms.
Regular anatomy of Gerd, lower esophagus sphincter, is a circular band of smooth muscle located at the junction of esophagus. It acts like a valve. It closes tightly after food enters the stomach, and it prevents acid and stomach contents from backing up. Esophagus. Esophagus is a muscular tube about 25 centimeter long. It connects the pharynx to the stomach. It moves through from peristalsis, which is the wave of contraction. Esophagus is lined with stratified squamous epithelium tissue to protect from friction. Regular anatomy continues diaphragm and esophageal hiatus. The diaphragm has a small opening called the esophageal hiatus. The pleura, which is the muscle fiber of the diaphragm, helps reinforce the lower esophageal sphincter, which tightens around the esophagus to prevent reflux, especially when coughing, lifting, or bending. The stomach. The stomach is located in the upper left of the abdomen. It's divided into cardio, fundus, body, and antrum pylorus. What it produces is it produces a hydrochloric acid, pepsin, intrusive factor, lines with thick mucus to protect against acid. When functioning normally, acid remains safely inside. Regular physiology of GERD, autophase voluntarily. The tongue pushes food to the back of the mouth. The pharyngeal phase is involuntarily. Soft palate lifts, which prevents food from entering the nose. Epiglottis closes, which prevents food from entering the airway. Esophageal phase is involuntary as well. Food enters esophagus and a peristalsis waves pushes the food downward.
I'm Nicole and I'll be going over the causes and treatments for GERD. So causes. There's not an exact known reason for the cause of GERD. It is, however, more likely to occur in people who have hiatal hernias, which is when the upper part of the stomach shifts into the lower esophagus. Factors that increase the possibility of developing GERD are pregnancy, smoking, and obesity. Diet is another risk factor for developing GERD, so consuming in foods such as alcohol, chocolate, minty food, garlic, spicy food, acidic foods such as tomatoes, and fatty/fried foods. Treatments. So, although there are a couple of treatments for GERD, it depends on the severity of it and how advanced it is. So some treatments may be more invasive than others just depending on how advanced it is. So a treatment for those who don't have it as severe or advanced, things like lifestyle changes could help. That would include quitting smoking, losing weight, avoiding triggering foods, avoiding very tight clothing, eating more frequent and smaller meals instead of larger and fewer meals, and chewing more slowly and thoroughly. An alternative to that would be medications, so antacids such as Alka-Seltzer and Maalox to relieve the symptoms. Histamine blockers could also help to decrease the acid production in the body. Lastly, in those cases that are a bit more severe and advanced, surgery could help. The Link's procedure is when a ring-shaped metal is implanted in the lower esophageal sphincter with the purpose of creating a reflux-preventing barrier. Or the procedure Nissen fundoplication, which is when, in more severe cases, the top of the stomach is wrapped around the lower esophagus to prevent acid refluxes from rising.
My name is Demi, and I'm going to be going over the histology of normal esophageal tissue and the histology of an esophagus with GERD. In here, this is the normal histology. You can see that the cells are densely packed in a uniform structure. The cells all around are the same size and shape. And then here in the GERD histology, you can see there are signs of inflammation shown here where it is hot pink. And then there's also dilated spaces in between the cells shown here. These spaces are due to the erosion from the bile and acid reflux from GERD. And on the bottom layer, you can also see that the cells are thicker and more compact together from the damage.
Thank you for watching our presentation. Here are our citations.